Hi, good evening, everyone, to all the viewers out here. It is such a pleasure for me to have with me one of the students who has aced the exam and from the city of joy, as we know it, that is Kolkata. We have Dr. Sauptik Sinha with us. And congratulations, Dr. Sauptik, for a wonderful rank. He's got a rank of around 500, specifically 561. And I would first congratulate him and his family on this wonderful, wonderful result and request him to just briefly talk about himself.
First of all, thank you very much, sir. And my name is Sauptik Sinha Roy, Dr. Sauptik Sinha Roy. I did my MBBS from Nilratan Sarkar Medical College and Hospital, Kolkata. I completed my internship in last year, May 2023, and I have secured an All India rank of 561 in this NEET PG 2024.
Wonderful. So, Onik Subhecha, as they say, Sauptik on that wonderful result. And maybe just request you to please share with us as to how have you utilized the Cerebellum app for your acing the exam.
Yes, sir. Actually, Cerebellum App has helped me a lot during this process. Honest means it has everything you require. The complete everything you require for doing well in the exam, Cerebellum will provide you. Be it MCQ, be it test, be it grand test, or the discipline you need to do study daily, because all the live classes are conducted in the evening period from 5:30 to 10:30 or 11 or sometimes 11:30. So you attend the live class, you prepare your own notes, and then in the morning you read that notes and solve the PYQs or the MCQs, and then you are ready. Almost after 4-5 days, the subject is completed. Then there will be a test and discussion. So in 4-5 days, the subject is completed in adequate depth. At the same time, you are doing it yourself also, because you are reading the notes and then you are doing the MCQs. Then there is a test, and then after 3-4 subjects, there is a cumulative test of all 3-4 subjects. Then there is regular grand test. So, and the teachers are really good. So everything you require are there in Cerebellum, I would say.
Dr.
And also there is
Sauptik,
BTR.
having a schedule, prior to having a class, do you think that helps? I mean, and having a live session in the app, is that helpful for you for your preparation?
Yes, sir. Actually, it helped me a lot, I would say, because I am never a disciplined person and I am also not a very structured person. So this was the only problem for me, because so I am someone who procrastinates a lot and I am not at all a disciplined person. So if someone guides me with the live class schedule, or there is a test that, okay, there is a test next week and you study the subject and then you appear for the test, this kind of gives me a motivation to study well, to work for the 7 days, because somewhere it gets difficult. When you start your preparation in the beginning phase, you are all motivated, you are all willing to do very well, but somewhere in 2 months or 3 months into the preparation, you are a bit exhausted, and then you need some kind of push, I would say. And also in this year, there are a lot of preponement and postponement. So in our, I would say that it is really useful, because if you are really disciplined, then it's kind of a different story. But for majority of the people, the structure, the discipline really helps us a lot.
That is where the point is actually. For majority of the people who are actually going to be disciplined and structured, I mean, they are actually in a very few number. You can actually count them on your fingertips. So for most of the
Yes,
people, since we are in the habit of using the social media and for a lot of other distractions that we are having, and in spite of sometimes not having a distraction, the kind of change in the schedule of the conduct of the exam, it was postponed, then again the date being changed again. I mean, for whatever reasons, I mean, that takes a lot of mental toll on you,
yes,
right?
sir.
We do require somebody to handhold us, guide us, and then of course, as you say, I mean, you are the live proof that somebody who can be guided and kind of being pushed in that right direction can produce such wonderful results.
Yes, sir. Totally
So,
agree.
if I were to take your advice, let's say a second year student or a first year student, I've just entered into a medical school. What do you think is the ideal time for start preparing for these exams?
Sir, I would say one mistake I did was that I started solving MCQ after my internship only. So I would advise any third year or final year student that, okay, you study whatever you want to study. You study textbook, or you focus on your building concepts, but also start doing MCQ. Maybe 10, maybe 20 in number, but if you start solving MCQ early in your preparation, I really believe that it will give you an edge, because sir, the last time I solved MCQ, I was in class 2 during my NEET UG, and then for 5.5 years, I never solved a single MCQ. And then I gave NEET PG 2023. That was after 5.5 years, I am in front of an MCQ.
Right.
So I would say, if you are planning to prepare, some of them are really good students who wanted to study well, but just solve 10 to 15 or 20 MCQs of the subjects you are reading. Maybe you are in third prof, you are reading INT and PSM. Just solve few MCQs. So I would say it will give an edge when you actually start your preparation, and also start focusing on your concepts first, because when you are in MBBS, many people will say that your MBBS, how you did in your MBBS and how much you study doesn't matter. But actually, I would say in the current pattern of exam, it does matter, because it really gives you an edge. I am not saying that if you are not good in MBBS, you cannot do well. This is totally absurd. This is not true. But if you are a good student, you will obviously have an edge, because the exam really, I believe that once to find the student who had a good concept or who had studied well in the MBBS, because everything is not factual. They are asking a lot of conceptual questions which you may not have studied in your post-internship or preparation year, but if you have studied well in your MBBS or attended your clinical posting, you may solve it. So
Agreed, 100%. And in your personal experience, as in when you took the exam, I mean, the exam was conducted in 2 shifts, right? So there was a variability with respect to the questions. But in your own assessment of the conduct of the exam, do you think what was the role that was played by the previous year topics or the previous year questions?
Sir, I would say previous year topics are important. The teachers only teach that previous year topics only, because all the lectures, if you see carefully, they are curated based on the previous year topics only. Teachers, they gave the conceptual clarity, they gave the tricks to remember, but every subject is huge. So the teachers teach what is the probability of getting asked only. So I would say previous year questions are not exactly repeated, maybe very few in number, but your preparation should be based on previous year topics only. And every app you follow, maybe knowingly or unknowingly, the preparation is based on these topics only, because the teachers only teach these topics in maybe in depth or with their experience or the probable topics of being asked. So I would say they are the things you need to do. If you are thorough in previous year topics, you will get selected. No
Agreed, agreed. What do you think was the role that was played by, or the contribution of the QBank and the grant test that you appeared for in Cerebellum?
Sir, actually, I attended all the tests of Cerebellum. All the subject tests are there. Also, the FMG section subject test and the NEET PG section.
Wonderful, wonderful.
So there is not a single test in Cerebellum that I didn't attend. All the subject tests starting from the launch of the app until date, till 11th of August, I attended all the subject tests of both FMG section and NEET PG section. And grant test also, I attended almost all the grant tests. Regarding question banks, sir, I completed the question banks of pharmacology, of surgery, the major subjects, which I believe, but I didn't get the time to complete the entire question bank. But I did the PYQ marathons. The PYQ I did of all the 19 subjects, the subject test and the grant test. And regarding question bank, I did few subjects only, maybe pharmacology and surgery and some bit of medicine and gynae. That's it, sir.
This is very I would say very insightful for me as a faculty as well, Sauptik, because a lot of people I have talked to, especially the ones who have got a better rank, right? I find 2 or 3 common points in them. One, most of them, as much as their schedule permits, whether they are interns, whether they are post interns, or they are in a job or whatever, a lot of them are trying to attend the live in-app sessions, right? In spite of the lectures being available to them in the recorded format, majority of the people who are doing well are the ones who are attending the live sessions. One. Second, it is very heartening to know that people are attempting the tests not only from the PG section, but also from the FMG section, right? And this is a consistent feature. So, I mean, this is I think a upcoming trend, which is good for us as well. And I would rather be very appreciative of the fact that a lot of you are appearing in most of the grant tests. So this kind of a consistency, I think this kind of a discipline is what, makes you more prepared for the exam. Mentally, you are wired up to look at a question, find out the keywords, find the statements, rule out certain options, and then come to the right conclusive answer.
Exactly, sir. This is totally true, because your preparation will take you maybe to top 10,000 rank. Means whatever I know, I believe that all the top 10,000 or top 15,000 people do know exactly the same. Beyond that, it's how the application of knowledge varies, and then your luck in the exam, your ability to rule out options. These things do matter.
Now, in your own experience of having attended most of those live sessions, were there any particular things that you recalled in the exam from a particular teacher, from a particular topic? I mean, I had an experience of a lot of people saying some mnemonics, some stories or something of that sort.
Yes, sir. I'm in my entire MBBS, my most favorite subject was pharmacology, because I studied pharmacology in great depth in my second year, and I
Okay.
also got good marks in pharmacology. So when I attended Goga sir's lecture for the first time in my post internship, I was like, why sir gives some such weird mnemonics or such stupid mnemonics? Because I will remember it anytime. I mean, this was my feelings. But in the exam, you remember only the stupid mnemonics only, and then you like,
Exactly.
yes, those funny mnemonics or those weird tricks which sir gives in the class. When sir teaches you, you will be like that. Okay, I don't need them because I will remember them. But in the exam, you will only remember that line, that funny mnemonic. So I am really grateful to Goga sir because my pharma is really strong in all the grand tests also and in NEET PG also, and all the credit goes to Goga sir. So I remember Goga sir's mnemonic also, and Zainab ma'am also shares a lot of tricks to how to avoid confusion and how to remember things. So these features I remember all means the tricks and the mnemonics to solve MCQs I really recall a lot in the exam.
All the more wonderful, Sauptik. So, Sauptik, now that you got a rank of your choice, I think what is the likely branch that you're going to be pursuing?
Sir, I'm going to take MD medicine most probably.
Excellent, excellent. So that is really, really wonderful to know, Sauptik. I hope we stay in touch. And please do convey my regards to, I would say, all the credit for your success to three people. First and foremost, of course, you. You are the one who has done all the hard work for yourself. Second would be, of course, your family members, including your parents. So my namaskar to them as well and my best wishes. And
Thank you.
third, I would also love to give a lot of credit to all your faculty back at NRS Medical College, maybe in their own small way, not in the exactly MCQ format, but I think at a subconscious or I would say a backend level, they also somehow contribute to our success. So best
Surely.
wishes to them as well.
Thank you, sir. Thank you very
And I
much.
hope that we catch up in person really soon with you bringing all those wonderful kancha golas for us.
Sure, sir.
At any
Definitely.
time we are in Kolkata, we are going to be more than happy to see you.
Thank you, sir.
Thank
It
you
really
so
means
much
a
again,
lot.
Sauptik.
Thank
God
you.
bless you. Thank you.